We begin with our coronavirus coverage. Australia now has 197 cases of the disease. Chief Medical Officer Brendan Murphy provided an update a short time ago.
The continued growth in cases of coronavirus around the world. There's 140,000 or so cases in the world, and in Australia we do have further growth, 197 cases as of 6:30 this morning, but we will expect to find more cases during the course of each day. I want to explain why we moved to institute social distancing measures, the most important of which is the recommendation that non-essential organised gatherings of greater than 500 do not proceed. Social distancing is a very important measure to delay the growth in the spread of coronavirus. We have early evidence of community transmission, mostly in New South Wales, but a little bit in other states. We have moved quite early to institute social distancing measures, earlier than some might have suggested, because the international evidence is suggesting that if you move before community transmission is well established, you can get much better benefit. So we've made the decision quite early enough so that we can in fact give people some few days notice to start it on Monday, so that we can have an orderly transition. But I want to say that this is a preemptive move to get ahead of the curve. Social distancing can be difficult for the community, we understand that, and we understand that the community is with us on the need to try and slow the spread of this virus in our community. And we do know that large gatherings, large groups are well known internationally to be one of the quickest way to spread a virus if there's community transmission. I do also want to address the issue that lots of people have been asking about the Cabinet and their contact with Minister Dutton, who, as you all know, has reported positive testing for coronavirus yesterday. I in fact joined the ERC of Cabinet on Tuesday when Minister Dutton was there, and I can assure you that Minister Dutton developed his symptoms yesterday morning, a long time after the Tuesday Cabinet meeting. Our case definition across the board is that you are only a close contact if you have been in a close contact within 24 hours of someone becoming symptomatic or after they've become symptomatic. No member of Cabinet was in contact with Minister Dutton within 24 hours of him becoming symptomatic, nor was I, in fact, in contact with him. So the Prime Minister was very, very clear to me that the Cabinet and all the public officials follow the exact same public health rules as everybody else in the Australian community. If there had been a requirement for quarantine, he was insistent that Government and Cabinet followed those rules. So we just followed the normal public health advice. No one had been in contact with the Minister in that period. I think I'll stop and take questions there. Thank you.
So just to clarify, if you are in contact with someone who's coronavirus positive, before their symptoms show, should you self-isolate or go into quarantine? Only
if you have been in contact with them in the 24-hour period before they develop symptoms. That's always been our public health advice. So if you've been in contact with them 2 or 3 days before they're symptomatic, they are very, very, very unlikely to be infectious, so we don't believe that you need to quarantine.
Sorry, is that new advice? I don't remember hearing that.
That has always been in the published advice. When we say a contact, we are always referring to what the public health definition of a contact is, and that's always been published on our website. Every public health unit in the country has it. It's always been a case definition of a contact is someone in contact with someone up to 24 hours before they're symptomatic. I know we talk about contacts loosely in the media, but that's always what we mean.
Is there even the slightest possibility that any of the Cabinet members might have stood up and get it up?
It is extremely unlikely. He would have had to be a very unusually infectious 3 days before he became symptomatic. We've not seen anybody like that in Australia. You can't rule out anything, but our public health rules are pretty clear that we think it's very unlikely.
We saw an almost full house at the NRL match last night. The NBL Grand Final, though, empty stadium. Why can we not get this agreement just a few hours after the PM addressed it yesterday?
Well, as I said, we are moving preemptively, perhaps a little bit earlier than some people would have said was necessary, given that the community transmission is very, very low at the moment. So we've given people warning, and organisations can take their own decisions, but we are recommending now that from Monday, to give people a bit of notice and to get ahead of the curve, that large events over 500 don't go ahead.
What's your advice to pregnant women? Should they self-isolate even if they haven't been in touch with anyone with coronavirus?
Well, I don't think you can self-isolate for the whole of a pregnancy. Anyone who's pregnant, as a matter of principle, obviously pays close attention to their health, and they will try and avoid contact with someone who has any infection. Influenza is probably more dangerous for a pregnant woman than coronavirus. The evidence that we've seen with coronavirus so far, and it's limited evidence from China, is that those pregnant women who have contracted it have had a mild disease, and it has had no adverse effects on the fetus or severe illness in them. But every pregnant woman takes it carefully.
Were you comfortable seeing an almost full house at the league game last night up in North Queensland?
Look, in North Queensland, there is not any evidence of community transmission there. As I said, we're getting ahead of the curve, so I don't think the risk associated with that was significant. We are starting these measures perhaps a little bit before some would have said they're needed. We in Australia want to flatten that curve and keep us under really tight control. We do not want to see rapid increases like we've seen in some parts of the world. That's why we're moving early.
This preemptive strike, do you think it will even out that curve? And how long do you think you estimate before we start to see a reduction in those cases?
Look, it's very, very, very hard to predict. We've got modelling that says an infection could take some months to go right through the community with a flattened curve, but it depends how it develops. It might develop in focal parts of the country, we might be able to control it. If it develops in a number of parts, it could last for quite a number of weeks. But at the moment, we are just focusing on containing and flattening it, and we review our public health measures every day. We're meeting daily as the Health Protection Principal Committee. One of the great developments we have now is that we have this national cabinet that the Prime Minister and the Premier have pulled together, and I was privileged to meet with them yesterday, and they are now going to meet every week, and they are going to pull together our national response, and they will be guided, as governments have been till now, by the daily expert health advice.
Are distancing measures likely to extend to schools?
At this stage, we don't think school closures are on the horizon. They are certainly something that could be considered if there's community outbreaks. The interesting aspect about schools at the moment is that children don't seem to get either much in the way of infection, or if they do, they get very mild infections. So at this stage, we don't feel that school closures are warranted. I would like to just make one other point. I think we referred yesterday at our press conference to the fact that there'd been quite a run on the testing, and we've had some temporary shortages in testing materials. I do want to emphasise that we are still saying, even because community transmission is so low at the moment, that we are focusing our testing on return travellers or contacts of confirmed cases who are symptomatic. We don't want people with just an ordinary mild cold in Australia to go and get testing. We need to preserve the testing for those who need it.
If person-to-person transmission spikes here, do we have enough capability in terms of swabs, etc., to continue testing?
We are working very hard now to ensure that we have enough testing equipment for that eventuality. Yes, we're doing a lot of work to procure and expand our testing capability.
And you think hospitals are well equipped?
Hospitals are doing a lot of planning, and they have made a lot of contingencies plan. Every hospital around the country has. That was an issue that was discussed amongst the premiers and the Prime Minister yesterday. One of the most important areas of preparation is to make sure we have sufficient critical care capacity if we get a number of people who have severe disease, and there's a lot of planning in that space, but there's also planning to make sure that people who do need hospital, and I do reiterate that if you did have a large outbreak in this country, probably 80% of people would be treated at home because they're so mild. But those who might need hospital, we've got plans to stop elective surgery, expand and open beds, find extra workforce. All of those plans are well advanced. So I think we have a very well prepared health system. There's clearly more preparation that's ongoing, and we've clearly got to make sure in this worldwide situation that we can maximise the resources available in Australia, such as those testing equipment.
And just touching back on Peter Dutton, has anyone from that federal cabinet gone into self-isolation?
No, there's no cabinet member who fulfilled the definition of a contact with Minister Dutton.
No other testing either?
There's no point testing unless you are symptomatic. We don't test people who've been in contact unless they develop symptoms.
Marie's Payne should isolate when gets back to the US.
Sorry?
Marie's Payne, she's isolating when she gets back to the US.
Unless she has been in contact with a case, she wouldn't be required to isolate. But because she's a return traveller, we would be recommending that she practice some social distancing, that she doesn't attend large gatherings herself, and that she tries to keep a reasonable distance from people as she goes about her normal life, but she doesn't need to quarantine or fully self-isolate.
Do you expect transport networks to be affected in the coming days?
Not in the coming days. This mass gathering issue is, we're talking about static gatherings where people are together for a period of time. We don't believe that the risk in casual contact, casual context of mass transport is sufficient to do anything at the moment, but again, if situations develop and we get much more widespread community transmission, there may be measures that are recommended in relation to transport. But at the moment, we are focusing on the gatherings greater than 500 people and trying to get the community to understand what social distancing means.
When do you think this will peak in Australia?
It is very hard to predict. If we get a large outbreak and we can flatten the curve, it could go well into the middle of the year before it peaks. But you know, there are some countries like, for example, Korea, which seems to have peaked quite early and controlled what was a very localised outbreak. One of the things we know about outbreaks and epidemics is that it's very hard to predict. They're quite focal. Every country is a bit different and they have a different experience. We're modelling a range of scenarios and we're prepared for all of them.
Well, is there a cut-off or a threshold, rather, of community transmission at which point the schools and transport? Is there a magic number there?
There's no magic number because it might depend on how focal it is, what part of a city, whether you do measures in one part of the city. So we would look at the circumstances as they arise.
The mass gathering ban, does that actually apply to cruise ships?
Cruise ships, HPPC is going to discuss the implications of this afternoon. That's one of the things we're talking about. My understanding is that most of the cruise ship companies are now cancelling or reducing dramatically. I suspect the cruise ship industry will go into some significant abeyance anyway, but we are going to discuss that this afternoon.
This mass gathering, is it a recommendation or is it an actual ban?
At this stage, the Prime Minister and the Premiers were keen to make it a recommendation, and in 99.9% of cases, people are responsible, organisations are responsible. You've seen all those organisations, such as the AFL, already announced that they'll have spectator-free matches. We expect people, as they normally do in this country, to be responsible. If there were circumstances where we thought there was a risk for someone proceeding with something that we thought was that they should stop, we do have powers to intervene, both state and federal powers, but at the moment the governments are very keen for it to be a cooperative partnership with the community.